Hey, hello, good evening, everyone. Thank you for joining us this Tuesday evening for our webinar, When Your Diet Isn't Working for You. My name's Alexa. I'm one of the clinical and administrative assistants at Philadelphia Integrative Medicine, and I'll be the facilitator for the webinar this evening. So without further ado, I'll get started just with some introduction about our founder, Dr. Tetlow. Dr. Tetlow founded Philadelphia Integrative Medicine, PIM for short, 13 years ago, and we offer patient care as well as teach and train others to offer the best of integrative medicine. PIM's vision is to empower, inspire change, and create trust with patients, PIM providers and staff, the functional medicine community, and ultimately the medical community at large. Dr. Tetlow maintains a patient care practice as well as a mentoring practice for clinicians in transition into integrative and functional medicine practice or in their maintenance phase of this. You can visit our website under the providers tab to learn more about this, and I will pass it on to Dr. Tetlow from here.
Thank you, Alexa. And I'd like to welcome everyone tonight. We're so delighted that you're making some time for yourself and to join with us. This is a webinar presentation that's taken a lot of coordination from the provider team, as well as the administrative team at the clinic. And I want to acknowledge Caitlin, who's been very central to creating this presentation, and you'll see and hear and enjoy a lot of time with her this evening. And we're so lucky that you have that treat and delighted. I'd like to just briefly say before we transition into a brief centering and meditation, that's a way that we will routinely start our evening presentations. We like to offer these every few months as a way to nourish you, to remind you to remember yourself. And we practice what we're preaching, and this is intended as a gift for your education, your inspiration, for your self-care, and we hope that's how it feels when you're receiving and participating and listening tonight. I'd like to acknowledge the management team at our clinic. I'd like to acknowledge Michelle, our clinical manager, for her honesty and courage through leading and guiding us through this pandemic. I'd like to acknowledge our other clinic co-manager, Christina, for her compassion and for her excellence, and the rest of our administrative team members. So Alexa, thanks for being here. Nicole was just with us previously. Kelly, Danny, Denise, Georgiana, and we're so delighted to introduce the rest of our provider team in a few minutes. Thank you so much to our team. We have an incredible and beautiful team at the clinic. I'd like to lead us in a centering meditation. We're focused a little bit more on feeling and sensing our body tonight. So wherever you might find yourself, I'm going to invite you to place your feet on the floor and take a few moments just to adjust your position so that you're comfortable and you feel like you're grounded. Your feet are on the floor and you can feel your feet, whether or not you're directly on the floor or through shoes or through socks or stockings. Taking a conscious breath and just noticing if you're breathing, or if that's just if that feels, it's intended as an invitation, just to allow yourself to breathe in and to let your breath out. So no need to hold your breath. Just letting yourself breathe, letting yourself arrive, and just acknowledging that it takes quite a bit sometimes to attend an evening event in addition to all that you're doing throughout the day, throughout this week, and throughout this extraordinary time that we find ourselves in. Feeling your feet, feeling your breath, and if it feels comfortable, just to gently lower your gaze or to close your eyes. And coming into this present moment with us. As we navigate these times, we will get through this together. And we are getting through this together, moment by moment, breath by breath. And how much more enjoyable it can be to be together and to connect, to learn and to open ourselves, and to release any sense that there's anything wrong with us. There is no right way to be. And you are remembered. And you can gently and compassionately remember yourself in this moment, just as you are, sitting, breathing, allowing whatever feelings, whatever sensations, just being present to yourself with as much compassion, with as much self-love, with as much forgiveness and gentleness as you can muster in this moment for yourself. Feeling your feet and feeling your lower body. Noticing what it feels like to sit. Feeling your seat in the chair. The sensations in your legs. As you breathe, feeling your trunk, feeling your belly and your chest. The sensations of breathing in this moment. Allowing your hands to be at rest and just feeling your hands, your arms. Feeling your neck, feeling your head and your body as a whole. The sensations and the feelings, these are always in the present moment. And this is a safe place to return to summon compassion for you. To bring your presence as much as you can into this moment, where the present moment is where we learn, where we love, where we forgive, where we connect, where we communicate, and where we give and receive. There's so much that happens. It all happens in this moment. So we invite you to be here with us tonight with an open heart, and also know that we have your best interest in mind. We want you to be well, and we want you to be as encouraged, as reassured, as informed, as empowered as possible. And it's part of our mission to also give these evenings to you as a gift. So completing this meditation, beginning to wiggle your toes and fingers, you can gently open your eyes. And it is my great pleasure to begin our webinar this evening by introducing the first of our provider introductions. I'll be introducing Linda Sherland, who is my administrative co-pilot at Philadelphia Integrative Medicine. And when I think of Linda, I think of deep wisdom. Some of you on the webinar tonight or who listen to the recording have the privilege of having her as your provider. And as you know, she has a tremendous healing presence. She sees you, she hears you. Personally, I'd like to acknowledge your perspective in addition to your wisdom, Linda. When I'm discerning what to do, I go and I ask and I discuss it with Linda. So thank you so much, Linda, for being with me, for navigating and leading PIM with me. I'm so grateful for you. I'm so grateful that you have moved here from Texas and that you have been with us for years. It is my privilege to introduce you tonight. And thank you so much for being here tonight and being in my life and being at the clinic. So we can.
Thank you so much, Georgia. I appreciate that. I wanted to just share a little bit. Welcome, everyone. It is wonderful to have you all here. I think you're just in for a wonderful treat tonight. I'd like to talk a little bit, just a skosh about Philadelphia Integrative Medicine. When I think about integrative and functional medicine, we think about healing-oriented medicine that is really driven not for sick care, but for well care, and coming into wellness, into our whole selves, looking at the whole person. We don't think of you as just a list of symptoms or that thyroid patient, but we think of you as who you are, as the whole person. Really believe that looking at all aspects of our lifestyle, including our relationships and relationships with us as your practitioners, are very important to us. And we really believe that a lot of healing happens in the relationships. Integrative and functional medicine is absolutely informed by evidence. We use all appropriate therapies. We use both conventional and functional medicine labs and medications, supplements, in addition to diet, lifestyle, and other recommendations that we have to make. So our next slide, Alexa. So who we are and what we do, you'll see that we're a physician, nurse practitioner, physician assistant, nutritionist, even our admin team. We have healers on our admin team. They're not official, but if you spend any time at all with our administrative team, you'll know and feel that healing effect. We really treat all forms of chronic illness. We also, but even more importantly, want to look at what can we do to bring you into best health. Some people come just because, not because they have necessarily a chronic illness, but they want to have their best life and their best health. We feel like that's very important. We have both an in-office practice and a telehealth practice. We've converted primarily telehealth during COVID, but we are available in our office as well. Our visits are eligible for insurance, and if you look at our website, you can see exactly how to navigate with your insurance company. We also have free consultations. Veronica is going to talk a little bit about those at the end of the talk. We'd love to invite you just to come in and meet us and visit with us. Join our newsletter. It's a way to keep up with who we are and what's going on in the world of PIM. We'd really like to know, we're always interested in who comes to our webinar. So if you would take just a few minutes to answer the poll, we'd really appreciate that. It kind of helps us plan for the future and know who's here. We'd love to know if you've ever participated in a PIM webinar before. And looking at our list of participants, I know some of you have been here and we always really appreciate you coming back. Also wonder how you heard about this webinar. Was it through a newsletter, through one of us as your providers, our social media? We've really been working to put things out through our social media. You can go ahead and begin to answer these questions now. Was it through an Integrative Therapeutics, one of our partners that sends out an invitation? Or maybe it was some other way. Maybe a friend invited you, or it could be anything other. The third thing we'd like to know, are you a patient? Are you a provider? Maybe you're both, or maybe you're neither, and you're just here to learn and here to experience what we have to offer. So we'd really appreciate you taking a few moments to complete the poll.
Linda, I'm not sure you can see those shared poll results, but if you can't, I'd be happy to share what the poll shows.
Nope, actually it just popped up. So I'd like to say that 38% of you have participated before, but 62% are brand new. So that's exciting. Welcome, we're happy to have you here. And it looks like the majority of you maybe found out through, well, it's kind of divided between one of us as your providers through our social media and also through other ways. So really happy for that. 69% of you are patients, and we've got 8% that are providers and 23% that have just come with neither connection. So super happy to have you, and thank you so much for participating in our poll. Next, it's my really great pleasure tonight to present Veronica Porterfield, the newest member of our provider team. About 15 minutes into our interview with Veronica, I was like ready to offer her the job on the spot. I was doing some journaling this morning, and the words that came to me about Veronica were intelligent, thoughtful, and compassionate. And she is a physician assistant, has her master's of physician assistant studies from Shenandoah University, Master of Science in Human Nutrition, and has had additional training through the Institute of Functional Medicine and the Karazian Institute. If you visited our website, maybe you've seen Veronica's video where she explains her beliefs and her really her philosophy on caring for patients. Beautiful and loving, super intelligent provider who's always really looking at joining who her patients are with the science that she brings, and bringing both of those things in such a beautiful way. So it's really my honor, my privilege to present Veronica tonight and have her join us.
Thank you so much, Linda. Thank you for that very kind introduction. And thanks to everybody who's here for making the time to be with us this evening. It's really a joy to be here. It's also my pleasure to introduce Caitlin, who is our featured presenter this evening. So in addition to extensive knowledge in the field of functional medicine and nutrition, Caitlin has complementary specialties in gut health and SIBO, as well as the more felt experience of nutrition, so intuitive eating and body awareness. She is a key member of our provider team, offering really important insights into patient care. So without hesitating one more moment or delaying any further, let's give our attention to Caitlin.
Thanks so much, Veronica. Good evening, everyone. Thank you all for being here. So today we are here to talk about food. Now, as you heard, I'm the nutritionist here at PIM, and I work very closely alongside all of the other wonderful providers we have. But my primary focus is on nutrition. And so we spend a lot of time talking about diet. Now, in my field, when we think of diet, we really look at this first definition here, the kind of food that a person, animal, or community typically eats. But the wider world, when they think of diet, they tend to gravitate towards the second definition, a special course of food to which one restricts oneself, either to lose weight or for medical reasons, such as I'm going on a diet. We're going to talk about what this means and really how we can kind of embrace the first definition and utilize food for the second definition as needed. A lot of times when we think about, restricting oneself or working on a diet for medical reasons, we have a harder time sort of making sense of that. And so that's what we're going to talk about today. So first, if we talk about diet as a food plan or a lifestyle, some examples here are going to be listed to the right: paleo or vegan or vegetarian, the standard American diet. These are typically long-term, and they're based on lifestyle preferences, cultures, values, finances, food trends as well, and also your general health. So we've got an image example here of the Mediterranean diet and the Western diet, and some of the major differences are listed there. Now, these sort of food plan lifestyle diets are those that we have found in cultures around the world that have helped those communities to thrive. So with the standard American diet, that's sort of the more modern Western diet that we find is perhaps not helping us thrive as much. So we'll spend a little bit of time on that. These are sort of the general population's way of eating. Now, when we look at diet as a therapy or a treatment, these are really to help adjust for certain sort of medical situations. So some of you may have heard of these diets before. So a therapeutic diet is normally prescribed by a healthcare provider, and typically either prescribed or implemented with the help of an RD or a CNS nutritionist. But, this could be a gluten-free diet for having celiac, or, perhaps there was a medical condition, a surgery, or a genetic alteration that requires different nutrients, such as, when something is congenital, or if there's Hashimoto's, what have you. So here's a list of some of the sort of therapeutic diets that we see often implemented. I do have a little note here that the keto diet is also sometimes followed as a lifestyle. That's more of a modern thing, but it did originally start as a therapeutic diet for children who are suffering from epileptic seizures. Many people are aware of that, but a lot of people don't realize that's how it's kind of started. And that's where most of the research is at this stage. So here we have the next slide, just the examples, and I've changed the color to a few of them to show what we're gonna talk about a little bit. But I'm actually going to invite Veronica to comment on this slide. These are different diets and food plans, and as you saw in Veronica's introduction, she also has her master's in nutrition and has been working in this field for a very long time. So she's going to spend a little time on this for us.
So just very briefly, some of these diets may be familiar as you kind of look through the Mediterranean diet, vegan diet, a paleo diet. You may have heard of some of these before. You may even have tried one or more of these diets, and maybe they worked well for you, maybe not. And you may even have had the experience where a friend did one of these diets and they did great and recommended it to you, and you tried the diet and had a completely different experience. So the way your body responded to that diet just was nothing like the way theirs did. So this is what we're going to talk about tonight, how we can kind of figure out, why a diet isn't working well for us, how we can consider that, how we can think about that. And sort of on that note, I'd like to turn it over to Dr. Tetlow to say a few words.
Thank you, Veronica. So one thing that we're wanting to emphasize tonight is how we think about food, how we figure out what's right for us. One of the ways to figure out what's right for us is sort of follow the rules or follow a guideline or follow a plan. And when we're looking at what's right for us, we want to remember to reference ourselves and to also to continue to stay in tune with our own body. So some of those questions have to do with listening, noticing, sensing, how foods feel. How does it feel in anticipation for a meal? Or how do we think about ourselves, think about the idea of going grocery shopping, or how does shopping for food, preparing food, eating food, what does it feel like? And how much enjoyment do we have in different modes and in different times, as opposed to what I should be doing, what is right, what am I committed to? So some of the questions we encourage you to ask are, what brings the most ease and enjoyment? What makes me feel good? What makes my body feel good? What effects are these foods that I'm including? What are they? What effects are they having on me? Do I need to unrestrict my diet? Do I need to remove some rules, remove some thinking, remove some of that mental control and thought process? And am I thinking too much about food? I'd like to transition back to Caitlin for our next poll.
Thank you all. So just quickly, we're going to throw another Zoom poll up here, and we're just curious, where are you in this whole realm of changing how you eat? Have you followed one of these diets? And have you done a diet for weight loss? Have you followed a therapeutic diet for some type of health diagnosis? Or have you made a food plan or lifestyle change to support long-term health? Maybe you had a friend whose brain fog went away when they went on a ketogenic diet or something, and maybe you said, hey, I'm going to try that for myself. Or did you watch a documentary and decide that there was a dietary plan that you wanted to follow? So thank you for completing that. Okay, so it looks like about 55% of us have dieted for weight loss, 36%, so around a third, have done some type of therapeutic diet for a health diagnosis. And then 45%, so close to half of you all, have done some type of food plan or lifestyle change to support long-term health. So if anyone here thought that they were alone, clearly you are not. We are all dabbling in this world of diet and health and wellness and nutrition, and it can be really hard to make sense of it all. If you're looking online, if you're looking on social media, if you're following the media in general, you're going to see lots of information about different diets and different superfoods and different nutrients. And so hopefully by the end of today's webinar, you'll have a better understanding of how you can kind of take some of that information and start answering these questions for yourself on a more personalized level. There's a lot of personalization that is required in nutrition. We have some very generic things that are helpful, but then we get more personalized and we dive into what's going on for you as an individual. So the first thing that I want to point out on this topic is that all of these diets and food plans have pros and cons. So for example, when we remove these modern processed foods, it can really make space for a more nutrient dense overall food intake. So we can really increase the nutrients that we're getting from our diet. We can get a lot more variety. We can reduce inflammation sometimes, and we can really improve just general symptoms and overall health. However, as Dr. Tetlow touched on, restriction of any food or food group can really carry a significant mental load. We also will restrict the available nutrients. We are omnivores. Humans are omnivores. And so if we choose to remove beans from our diet or all animal products from our diet or eggs from our diet, we do increase the risk of restricting the available nutrients. So we want to just keep that in mind, whether you're making a lifestyle change, going on a diet for other reasons, or doing a therapeutic diet for health reasons. We want to just kind of keep that in mind and make sure we're working with the appropriate team to get things changed for good and in a safer place. So we're going to start here by talking about the standard American diet. Believe it or not, I have a pro and con list for the standard American diet. Those of you who are healthcare providers on here may be surprised to see that. Of course, we hear all about the cons of the Western diet: promotes chronic disease, increases the risk of numerous nutrient deficiencies. There are many pro-inflammatory foods on this diet. However, we want to remember that it's convenient, it's affordable, and it almost always provides adequate calories for human life. And it is typically fortified with maybe the bare minimum of essential nutrients, sometimes not all of the nutrients that we need, but there are these benefits to, having access to some type of food, even if they are more like processed foods and food-like products. So it's maybe not a good long-term plan. We don't have anyone who is going to say that this Western style diet, which is characterized by high intakes of red meat, processed meat, prepackaged foods, candies, sweets, high fructose corn syrup. No one's going to say that these are promoting optimal health, but it's almost always providing adequate calories. So we can keep that in mind and maybe, save some of our judgment. But we do have some signs that this may not be working. So for example, if you see anything on this list that speaks to you following a standard American diet, then you may want to start making some changes if you have the ability to do so. So new symptoms have arisen or old symptoms have not improved. You have signs or symptoms of nutrient deficiencies. You have increased feelings of coldness or pallor, which is, that light, pale skin, weak hair, nails, constant or frequent hunger, or GI issues, any other health issues, really, out of range biomarkers. Nearly any symptom or sign can be attributed to following the standard American diet. That doesn't mean that it's the root cause, but it does mean that there are some changes that you can make when you have some of these things showing up. So I'd just like to kind of touch on sort of our standard American diet first, because we try to blame it for every single thing, but at least you have enough calories, right? So try to kind of keep that in mind. So next, we're going to look at a diet that a lot of people view as the healthier option. And this is a vegan or vegetarian diet. So here are some standard pros. Tends to be pretty rich in fiber and phytonutrients. It can be very rich in anti-inflammatory foods. The produce itself is really rich in vitamin C, vitamin K, certain B vitamins, especially B9, as well as potassium, which can be hard to get in if we're not consuming enough produce. And it eliminates highly processed animal products. But I've got a little star there. Doesn't necessarily eliminate highly processed foods. So if we look at the next slide, we've got our cons. So certain nutrients are actually poorly absorbed in the plant-based form. So plant-based zinc and plant-based iron are poorly absorbed. There's almost essentially zero B12 available on a vegan diet. Vegan and egg-free diets and shellfish-free diets are low in choline. It's not the most bioavailable calcium that's out there. There's definitely calcium there, but it's not the most available form. There are some genetic SNPs that actually make it hard for us to convert certain nutrients from plants into their active form in the body. So this gene that's listed here makes it difficult for the body to convert beta carotene, which we find in carrots and other orange hued foods, into active vitamin A. It can be a very carb heavy diet, which can be really challenging for certain individuals. And again, it does not eliminate the highly processed foods and can be high in food-like products. So when you're looking for those alternatives, you may turn to more processed options sometimes. It can be low or low-ish in protein. So I just like to show the pro and cons there. And an example of what you might want to do here is start to be aware of what you're getting when you're getting a vegetarian diet or a vegan diet, and eating more like the picture on the left and maybe less like the picture on the right. So I'm just trying to highlight here that the label does not necessarily indicate that it is healthy or unhealthy. And as we'll talk about in more detail, it doesn't necessarily indicate that it's the right choice for you just because a friend is doing it or it's growing in popularity. It doesn't mean that if it doesn't work for you that you're a failure. It just means that it wasn't the right fit for you. And so we're going to learn a little bit more on how to make that determination for yourself. So I want to talk a little bit about a plant-rich diet. So we've got this idea of plant-based diets or plant-rich diet, and this doesn't necessarily mean that it's plants only. It just means that we are rich in plants. Our diet is rich in plant foods, eating more produce, eating more plants in general. So if we look at this next slide here, I've just got a quick little question here. How many plants do you eat per day? You could follow any of these different diets and still not eat a wide variety of plants. So we're going to do one more quick poll here. I'd like you to just take a moment, think about your day and see if you know how many plants you eat per day. So for example, do you have eggs with spinach and some sweet potato and some fruit for breakfast? Then you've got, 3 or 4 different plants right off the bat. Do you have a smoothie with a bunch of different greens in it? Or are you just, maybe having oatmeal and almonds where maybe you're having 2 plants present there? So we're just talking different plants, not the serving size. Just take a moment to kind of go through your day and get a little bit of an estimation, and then just answer if you think what category you're in. So we have, we've got some results in. So it looks like 38%, so about a third are getting 0 to 5 plants. And then 63%, about 2/3 are getting 6 to 10 plants. So we didn't have anyone in these higher categories here. And that's because it can be challenging when that's not what we're focusing on. If we're just focusing on eliminating a category of food, we may still not be remembering to replace it with adequate nutrition. We may not be remembering to get the diversity that we need. When we have symptoms and we want to restrict food to try and make our symptoms go away, we don't always remember to replace it with adequate diversity. So just kind of keeping that in mind. And I want to point out that as you'll see on the next slide, that plant-rich eating can be vegan or vegetarian. So here's an example of a smoothie in the morning. These are some cauliflower black bean tacos, and this is a Mediterranean salad. And I counted up what was in this, and this is 12 different plant foods. So eating, this really plant-rich diet, this is 12 different foods. But you may still find that even when you're really trying to eat this whole foods, plant-rich vegan or vegetarian diet, you may still have signs or symptoms that are saying that it's not working for you. So I've got that list here. I'm not going to read through the whole thing, but feel free to take a screenshot if this is a diet or lifestyle that you follow. We want to be paying attention to these signs and symptoms of nutrient deficiencies, anemia, poor immune function. Old symptoms have not improved or new symptoms have arisen. That's the number one thing I would encourage you to pay attention to when you make your dietary changes. If you're making dietary changes and you're either getting new symptoms or your old symptoms are not improving, then your diet maybe wasn't a big part of the problem. There's something more that needs to happen there, or the diet that you've transitioned to is perhaps not the right solution. So I also want to point out that a lot of times more restrictive diets can cause orthorexic or disordered eating thoughts and behaviors. That's when we're thinking about food too much. We're worried about how healthy our food is. We're really afraid of deviating from, quote, what we've determined are very healthy foods. And we maybe have some judgment and morality around the food choices. So paying attention to that, as well as, social events, not that we're participating in a ton of social events right now anyway. But, if you do have a difficult time, feeling comfortable going out to holidays or out to dinner due to some of these dietary restrictions, we want to kind of think about it again. And then stomach acid and biomarkers are things we want to pay attention to with this diet and lifestyle in particular. So making sure that we're paying attention to our digestive capacity and iron, cholesterol, and triglycerides. So just kind of paying attention to these things to see if this is the right fit for you. Then we're going to look at another whole foods plant-rich diet, and that's the paleo diet. A lot of people assume that the paleo diet is just sort of a meat-heavy diet, but it doesn't have to be. It certainly can be, just like a vegan diet can be a processed food diet. You can still do this in a plant-rich way. So I put 3 meals here for that would all fall into the category of paleo, and this is 10 different plant foods. This is still a plant-rich diet. Now, there are, of course, pros and cons. So, it may not be rich enough in fiber or have enough calcium, as you see, like these signs that this may not be working. So signs and symptoms you want to pay attention to. Again, things aren't improving or things are getting worse, or we maybe are having concerns with calcium. A lot of times calcium is the main nutrient issue that we see when people are following this diet. We also see constipation increase sometimes. So occasionally, if you really increase your animal protein and you decrease your fiber, that may be hard on your digestion. And so you want to make sure that you're kind of tweaking things appropriately. So some other similar things here about dietary restrictions, unsafe weight loss, and we want to pay attention to these biomarkers that can be out of range. So, there aren't as many deficiencies with paleo just because animal-based nutrients are typically more bioavailable, but it still may not work. So you may want to add in some of these foods that you've eliminated. Perhaps legumes or grains or dairy are helpful to you and your individual sort of makeup. So maybe your diet becomes more flexitarian or more varied, and you've got a little bit of dairy and beans and grains, and you've got a little bit of animal protein or eggs or, meat or fish or something like that. Just pay attention to what your symptoms are and some of the things that we've listed in the previous slides. Start there, start kind of thinking about that, Am I consistently having these biomarkers out of range? Perhaps the way that I'm currently eating is not working, regardless of what that way is. Perhaps that's just not working. Let's start questioning that. Let's start working with a healthcare provider and start tuning into ourselves as well to see if there's something that we can do to improve these symptoms. So next, we are going to touch on some therapeutic diets. So I'm just highlighting here low histamine, low FODMAP, and candida, because these are the ones that I'm seeing more commonly being used these days. I don't know why these are growing in popularity right now, but this is what I've seen. And I want to point out that therapeutic diets are almost always short term, unless there is a specific allergy or a minor change that has to be made. Like if you're lactose intolerant, you may forever avoid dairy. But typically, these therapeutic diets are going to be short term. They are primarily helping with symptoms, and they can be very useful, but we still want to search for the underlying cause of why you can't tolerate these foods. So we want to also think about possible deficiencies, and we want to make sure that we're paying attention to how we're interacting with this plan, if it feels restrictive, if it feels right to us. And really, just having that conversation with yourself before you say, okay, provider, yes, I'm absolutely interested in doing this diet that you think is a good fit for me. Maybe you just, you say, well, actually, I'm not sure if that's going to work for me for whatever reason. And can we take another approach? Can we use something gentler? Can we do something less restrictive? Or financially, it doesn't work. I'm just not going to be able to do that, right? There are going to be lots of reasons. So just have that conversation with yourself before we try to dive in, because if you just really are like, I can do anything, and you don't really think about your own lifestyle, then you're not really setting yourself up for success. And then when you inevitably can't stick to it, you're more likely to blame yourself or feel like a failure, when it has nothing to do with that at all. It's just a matter of making sure that everybody on your team is paying attention and identifying, if it's going to be a good fit. So we are going to look at the low FODMAP diet. As some of you know, I really specialize in SIBO. So I have tons and tons of people who are coming to me on the low FODMAP diet. And maybe they've been on a form of it for years because they have IBS or they have SIBO. And so here are some of the pros. This removes the certain types of fiber that feed bacteria in the small intestine, which can improve symptoms in just a few days. I have seen people improve symptoms in about 3 days when transitioning to low FODMAP. That is possible. Not everyone is going to improve like that, but that's what happens. Again, that's symptoms. So this has been shown clinically and in research to reduce these symptoms, which is amazing. I mean, at the end of the day, we want our symptoms to improve. However, again, this is causing some type of restriction. And so we are going to see cons as well. So while we're not feeding the bacteria in the small intestine, we're also not feeding the bacteria in the large intestine. We're eliminating many of the foods that the bacteria in the large intestine need. That damages the microbiome and can cause further damage to the gut lining. So that's the biggest thing that we don't want to ignore, is that we want to make sure we're getting some type of safe fiber in our diet, whether that's smaller doses or a different type of fiber, even if we are trying to reduce our symptoms. It can also be restrictive and difficult to follow. It can be really hard to eat out with friends or eat out in general, because garlic and onions and shallots and alliums, things shown here in this picture, these are things that are typically avoided when we're following the low FODMAP diet. So you can have a really hard time trying to go out to a restaurant and avoid alliums. That's not an easy thing to do. We're also, reducing a lot of vegetables or eliminating some of these vegetables that can cause nutrient deficiencies. And a downside of any of these diets is it can trigger a good or bad mindset around food. If we have a red list and a green list, that can sort of live with you for a while. And years later, you can be like, I stopped eating apples when I did the low FODMAP diet 15 years ago. And I've just always associated them as a no no-no food, even though I don't have those symptoms anymore, or I've healed that part of my body. So we just want to be watchful of triggering that mindset. Then the last thing here, it's not a cure. The low FODMAP diet cannot cure SIBO. A lot of people really think that that is what they're doing. They're curing their SIBO or their IBS when they go on a low FODMAP diet. And really, it's just reducing or eliminating the symptoms, but it can cause more problems down the line. So we want to make sure that we're really doing all the other important things for these types of conditions. For anything that requires a therapeutic diet, we don't want diet to be the only thing. It's often just short-term helping with symptoms. And of course, the nutrients that we're providing can also be very helpful, and we can reduce inflammation and all of that. However, it's not typically going to be the only thing that we need. And so we want to make sure that we're kind of bringing other things to the table and using all available safe and evidence-based modalities. So again, some of the signs that this might not be working. I think a big one here is the signs and symptoms of low fiber, signs and symptoms of low calcium, because usually it's a low dairy diet, and also lower in cruciferous vegetables, which are sources of calcium. Microbiome insufficiencies. So if you were to do a GI map test or another stool study with us or another provider, and you see a low diversity of species, that's very common after following the low FODMAP diet for an extended period of time. And then some of these are going to be similar to others. So really making sure you're paying attention to these different mental, emotional, and physical signs and symptoms that can come up with any of these different diets. So just a quick little reminder that all of these food plans and therapeutic diets will have pros and cons. And our food intake is also tied to culture and our values. Now, ideally, your food plan should align with your lifestyle and your values while also supporting your health. But that's not always what happens. And so you can choose to compromise. You can choose to pick one over the other. You can choose to kind of dig deeper into that as well. But ideally, we don't want to have to do a complete 180 of our culture and our values in order to resolve our symptoms from the diet. It's just probably not the right long-term diet for you, or even the right therapeutic short-term diet. And then we also, again, want to just be paying attention to our food language and how it can have a significant impact on our mental load and on our relationship to food when we are using these good-bad dichotomies. So before changing your diet, pay attention to your mental health and these thought patterns. Plan for a short-term elimination of the foods. Plan for a structured reintroduction of the foods, which we'll touch on a little bit more later. Listen to your body. Practice mindfulness and intuition, and follow a therapeutic diet under the guidance of a trained nutritionist. So I'm going to pass this over to Dr. Tetlow while we get into kind of the next stage of this.
Thank you, Caitlin. That previous slide is one of my most favorite slides. So if you're watching the replay later, if you choose to listen to this presentation again, or many of you who are listening or will eventually be listening on the replay, it's just so helpful to get these guidelines about how to think about and how to be prepared for making a change, especially if it involves saying no or restricting or removing some of these foods. I'd like to comment that as Caitlin and I have talked over many times, and as we discuss as a provider team, because we meet every day to discuss patient cases in the morning, the discussion of nutrition and the role of food and food choices and how we eat is not covered in conventional medicine. Each of us is trained conventionally and then has gone on to do additional degrees in training and to gain additional experience in functional integrative approaches and certifications in order to provide care for you at the clinic. And if you simply stop at conventional care, you will not have any emphasis or information or knowledge or any of the evidence base discussed about the role of food in illness and in healing. So in this next slide, we have a couple of sections here. I'm doing mindfulness reminders. This is a section on how to identify foods that work for you. This is also about bringing foods in. How do I figure that out? The foods that I want to attract to me, that I want to be choosing more, the ones that are working for me. How do I explore that relationship that's working with foods? And one of the things we want to mention immediately is, it's a theme you've been hearing, which is being present and noticing what happens for you when you're eating. So this has to do with embodiment, being present in our body, and actually having the awareness of sensations, which is all level of sensations. It's thoughts, it's feelings, and it's physical sensations. And that's the quality. Those are the things that we have available to us in the present moment to give us information. That way of sensing and deciding and reflecting and making choices is in contrast to what are the rules? What is this person telling me to do? Or what is this podcast telling me to do? Or what is my friend telling me to do? Or what's worked for my friend? It's not being told, and it's not from the outside. It's from the inside. Linda's going to talk a little bit about supporting digestion and that how it can be helpful to identify foods that work for us.
Thanks, Georgia. You know, one of the things we find is that people will come in sometimes to appointments looking for the right diet, the right way to eat. They're having bloating, they're not feeling well. And, you know, sometimes it can be really, really simple. And one of the first things we often like to talk about is what we call eating hygiene. Or, you know, we talk about eating hygiene, we talk about sleep hygiene or our personal body hygiene, but it's how do we care for ourselves and how do we care for ourselves around food? And one way that can really help is to stop grazing, you know, kind of this snacking all day, or there was a time, you know, where it was popular to eat 6 small meals a day. But what happens when you do that, we have a thing called migrating motor complex, which allows our food to move through our digestive tract. And if we're always hitting it with food, it doesn't ever have a time kind of rest and recover and do the process of digestion. So one simple thing is just think about spacing out your meals for 3 to 5 hours. And if you're like, oh my goodness, I get so hungry, or I get tired, or I get a headache, you know, going back to that mindfulness that Dr. Tetlow just talked about, it's remembering that you need to eat enough food, making sure you have protein, at each of those meals, and that you're eating enough. So tuning into the body and listening. Another thing is, how do we get that digestion started? Kind of like those digestive juices flowing. The first thing is just smelling and looking at your food. You know, have you ever walked into someone's home, you're coming for dinner and you walk in and it's like, oh my goodness, that smells so good. And your mouth starts to water. And when your mouth starts to water, then we start to make stomach acid and we begin to get ready to take food in. Same thing when we look at food. And that's another great reason to have very colorful, beautiful food to look at, because again, that's going to stimulate our digestive process. And then slow down. Slow down. I walked in this evening and my husband wanted to watch something on TV and he's standing in the living room eating food. And I'm like, sit at the table. You know, so it's like, sit at the table. I also think about like even setting the table, having your dishes, not eating out of cardboard or out of a box, but off of a plate with real silverware, maybe even, oh my goodness, a cloth napkin. And you may think, what in the world does a cloth napkin have to do with my digestion? But it's really about honoring the food you're eating and honoring your body and knowing that this time is set aside and we want to be in our parasympathetic nervous system, which is our rest and digest nervous system. If we're running around and we're texting on our phone and we're talking or we're watching TV, we're reading, you know, the body is doing something else. It's not thinking about the food that's coming in and what am I going to do as a body with this food. And so all of those things are really kind of simple, but they do involve slowing down and focus mindfully on what we're eating. You know, if you've ever gotten to the end of a meal and, you know, I can't even remember what I had for breakfast. That may be because you just kind of chunked it down and kept on going. So we want to remember. Another tip is not to drink too much water. I'm really bad about not drinking water throughout the day. And I'm from Texas. It's hot. I'll sit down and we drink tea. I don't drink sweet tea, but, you know, I'll have 3 glasses of tea before I ever even start eating. And what that does is it waters down that hydrochloric acid. So I don't have the strength of my digestion. And so remembering we want about 8 ounces of fluid with our meal, no more than that. And so in between meals, we definitely want to keep ourselves well hydrated. But when we sit down to eat, kind of minimize what you're drinking. And these are just kind of simple tips. And notice if some of those symptoms don't begin to improve, even bowel movements may get better, less reflux, less bloating. And so I'll have Caitlin's going to talk a little bit more about elimination and reintroduction of foods.
All right. Thank you very much, ladies. So the reason we started with mindfulness and digestion is that if you're going to embark on any type of an elimination diet or therapeutic diet, there's going to be a period of structured reintroduction. And what we're doing is we're doing food challenges. So if we are removing a bunch of different foods and then we're going to reintroduce them, well, the goal there is to pay attention to our symptoms. And so practicing that mindfulness and supporting digestion is really, really helpful. What we sometimes see is that it's not the pizza that's causing symptoms. It's scarfing down, 6 slices of pizza very quickly alongside a large volume of soda, perhaps. And so it may not be that you actually have any type of sensitivity to those foods. It may just be the environment and the way in which you interact with and consume those foods. So really slowing down and becoming mindful can be very helpful in actually getting that accurate data when you do your structured reintroduction of any elimination diet. Because like I said, those therapeutic diets are short term. A lot of times we're just trying to identify a handful of foods or a serving size of certain foods that are responsible for or contributing to your symptoms. Now, the next thing I want to point out here is food journaling and micronutrient tracking. So food journaling can be a way to just kind of pay attention to the foods that you're consuming regularly so that you may be able to identify symptoms without having to do a full elimination diet. So if you just notice that on Wednesday seems to be a day that you're more likely to have symptoms, well, let's start tracking what's happening on that day. Are you noticing that, if you're keeping a food journal, is that a day when you're more likely to eat out? Or is that a day when you eat, leftovers from the fridge, or you're out of food from the fridge, so you're hungrier and you're eating too quickly, all kinds of things. And in the process of food journaling, you can utilize this program called Chronometer, which I use for micronutrient tracking. So here you can set different targets and, they give you sort of these different circles here that show what percentage of different categories of nutrients and antioxidants that you're getting. But on the next slide, you'll see that you can actually get the specific micronutrients. Now, all of this is ballpark. None of this is going to be perfect because I'm never going to ask someone to really be measuring their food. And this is coming from the USDA food database and other sources, that there's going to be a margin of error. But what we can start to pick up on is patterns. Maybe in this example, this individual doesn't use any iodized salt and doesn't eat enough seafood or doesn't eat seaweed and is really just not getting adequate iodine. And so that can give us a little bit more information about this. And really, we're just trying to indicate if we need to make dietary changes, use any supplements, or look into any additional testing. So we've got GI testing, we've got micronutrient testing, we've also got food sensitivity testing. So different additional tests. So once you've sort of started with the mindfulness and the digestion, it may be necessary to do an elimination or not, but typically the food journaling and micronutrient tracking can be helpful. And if we need something further, we're still having symptoms, Veronica is going to touch on some of the food sensitivity tests that we use.
Thanks, Caitlin. So I think it's really important to contextualize this. And I think, the conversation to this point has really brought us and given us really good context for this, particularly when we're talking about removing a food, proceeding carefully and thoughtfully when we're going to be eliminating things from our diet rather than sort of casually or without a lot of thought. So we take the whole notion of removing foods, pretty carefully and thoughtfully. And I want to focus tonight. Is it possible to advance the slide? Just a quick second. Awesome. Thanks. I want to focus on Cyrex testing, particularly with respect to gluten, because I find that a lot of folks that come to us have gluten on their mind, either because they suspect that maybe they have a gluten sensitivity from their own experiments at home, or because maybe they have a family history or some kind of genetic predisposition or propensity to having a gluten sensitivity, or maybe kind of on the flip side, they've removed gluten because they think that's the right thing to do. And so there can be some confusion around whether there's truly an issue with gluten, and if so, kind of what to do about it. Is it temporary? Is it permanent? And so forth. So a lot of questions come up around removing gluten in particular. And can we advance the slide just one quick second? So Cyrex testing is one form of testing that we use that really sort of comprehensively looks at the body's reaction to different proteins in wheat, and also antibodies that can cause celiac disease manifesting in the gut, in the skin, or in the brain. And, when patients come to us and ask, like, I think I might be sensitive to gluten, but I'm not sure. It's sometimes helpful to have evidence. Sometimes it's helpful to have, some sort of clarity around whether it's truly a problem for a person or no. As we've just sort of mentioned, there can be a lot of other factors that can cause problems with digesting the food. And so we need to know, like, is this actually an immune response that you're having to gluten or not? And so this particular test, Cyrex 3X, is one that we really like to get a comprehensive view of the immune response to, as I said, a variety of proteins in wheat, and also antibodies that you may have to wheat, and to determine whether gluten is something that truly is an issue for you or no, whether it's something that you really need to consider removing, because removing gluten is not generally a small thing. It can usually involve a lot of the foods that people are commonly used to eating. And so taking a sort of a more thoughtful approach is often helpful. So we can, I think, maybe if people have questions about this in the question and answer at the end, we can cover it further. But I want to move on to the next slide now. If it is determined that somebody has an issue with gluten, then there's a subsequent test that can be run. It can often happen there are cross-reactive foods with gluten, and it's not true for everybody. So if you look at this list carefully and you think, oh, what are the cross-reactive foods to gluten? I have a gluten problem. Do I need to remove all these foods from my diet? The answer is no. But there are foods that have protein structures that are similar enough to gluten that when a person who has a gluten sensitivity consumes them, the body can kind of get confused and think that, oh, maybe I'm eating gluten now, and have a similar reaction. So for people who do have a gluten sensitivity, doing some further testing to determine whether there are cross-reactive foods. The reason I bring this up in particular is because, we've had several folks come to us who have a known gluten sensitivity, but still don't feel well, and wonder, I know I'm being super careful with gluten elimination. I know that I'm not, cheating on the diet. I'm not, getting any gluten from restaurant food. Like, I'm super careful, but I still don't feel quite right. It's often useful to test cross-reactive foods to see if, in following a very careful gluten-free diet, if you have a cross-reactor, you're going to react to rice, perhaps, or perhaps to dairy, or perhaps to any one or number of these foods, which would undermine your other efforts. So it's helpful to have this information as well, just along the sort of track of talking about gluten.
Okay, and so for the last thing on this section, Dr. Tetlow is going to touch on micronutrient testing.
Thanks, Caitlin. Thanks, Veronica. So I'm going to be, and we can go to the first slide. I'm going to be fairly efficient in just 3 slides, just to talk a little bit about specialty testing. But I also want you to know you have done a beautiful job as an audience so far. We have had an incredible group, a core group of people, and no one's left the webinar, and you're doing amazing. We look forward to a question and answer and to interact with you. If you want to start to formulate questions for us, please put them in the Q&A, and we look forward to having some time to really interact and to answer your personal questions. So I'll be streamlining this section. This is just to say, I'm talking about 2 different types of micronutrient tests. So at Philadelphia Integrative Medicine, we are testing saliva for cortisol, for example, urine for mycotoxins. We're testing blood for hormones and all these metabolic markers. We're testing your poop. We do lots of stool studies, but what I'm talking about is 2 specialty tests that are examples of micronutrient tests. And this is a very comprehensive called a NutriVal test that we'll do, that will look at all of these sections. So oxidative stress means how am I doing with my wear and tear? That means, am I getting enough antioxidants in my diet? So antioxidants are CoQ10, they're vitamin E, they're cysteine, they're selenium, they're glutathione. So we look at all of those markers. We look at the mitochondria. Am I having the cofactors and the nutritional components to form energy? Omegas. Am I eating and digesting and assimilating enough of these anti-inflammatory fats to populate my cell membranes to reduce inflammation in my body? Toxic exposures are about heavy metals and other factors, but we look at cadmium and lead and mercury and arsenic. Methylation balance is really important, but the nutrient cofactors that address a very important biochemistry called methylation, which you can learn more about in a free consult. But methylation is a really important background process happening all the time. It's one of the reasons why when you change your diet, your symptoms improve and you get better, is because you're enhancing methylation. So very quickly, just to say, we have a complex example of a test result that you might see. So next slide. We might do a more complex test. And what's wonderful about our practice is that some people want to get into the details and the nitty-gritty, and some people just want to get the bottom line. So we have a little something for everyone, but this is just to show that there really is a complexity and a scientific background and basis for how we counsel you and how we care for you. We're always adapting test results and explaining them in a way that makes sense. This particular picture is showing, for example, on the bottom left, there's a urine test that can look at organic acids that's going to tell us whether or not it's likely you have yeast overgrowth in your body. So D-arabinol or D-arabinose is a marker that's found in urine. And we use that as a marker to help to tell us whether or not yeast is an issue. And we're getting lots of information about vitamins and other metabolic markers when we're doing organic acids testing, which is a urine-based test, which we, judiciously choose with you. We figure out what tests are insurance reimbursed, when's the time for a specialty test, and really personalizing your care and choice of testing and going at the right pace, and also deciding if we want to get that further information or what's the right direction with your health and wellness as the foundation. So next slide, I want to just mention that SpectraCell is a company that does an amazing micronutrient test. So micronutrients, this is a particular test that looks at nutrients in white blood cells that live for 5 or 6 months. So this test is extraordinary for a 5 to 6 month average nutritional level for 33 nutrients. This is an example of biotin, one of the 33, showing you some symptoms that can relate to biotin deficiency, some food sources, but also we'll look at the pattern of a deficiency, and we'll think about the foods and also the way that your care plan would be adjusted and changed based on a pattern in a micronutrient test. It's one of my favorite tests because it's such a powerful average. It's not a spot check. It's not what you ate yesterday or last week. It's really what nutrients would help to make your immune system. This test actually looks at exposing your lymphocytes, your white blood cells to nutritional factors, and actually shows how those white blood cells will respond positively when it's in the presence of those nutritional factors. So it's really finding out what your body needs so that your immune system, especially right now, can be optimized. So I'll hand it back to Caitlin.
All right. Thank you so much, Dr. Tetlow. So we kind of got into some details of how to identify the foods that work for you. And we want to, highlight that you may have a hard time tuning into your physical body for many reasons: a skewed relationship to food, history of food insecurities or eating disorders, or even that orthorexic tendencies, that history of trying to eat perfectly for health. And so we want to really highlight that functional nutrition, while it is incredibly important, and adequate nutrition is the foundation of health. Food and nutrition can reverse chronic disease and improve quality of life, but it's not the only thing. Sometimes we take it too far. It isn't only for health and well-being. So we want to make sure that we're thinking about enjoyment, culture, values, and our relationship to food. Are we over focusing on the moralistic terms of good versus bad? Are you saying, oh, I was bad today, I had a brownie after dinner? And are you displaying that to your family, to your friends, to your children, to your partner? Really internalizing these things just because of how we're interacting with food. If we over-focus on food as fuel or as disease prevention, we can really damage our relationship to food. And so I do think that when you're embarking on these dietary changes, that you ask yourself, do you think of food as fuel? Do you think of it as disease prevention or treatment? Or do you think of it as enjoyment? What makes sense to you? I would say it's really all three. So even if you perceive it as one way, you're eating for flavor and preference, it's going to be all three. Regardless of what you're choosing, it is impacting your overall health. It is impacting your enjoyment. It is impacting sort of your survival, right? Your calories in and out. So rather than living in this black and white mentality, it's important to try to find the gray area of using food and nutrition for health. That's what we kind of want to end on, to make sure that you understand that tuning internally can be such a useful tool here. And we're not aiming for perfection. We're really trying to find this gray area. So we've got this last sort of summary slide here for you that's got some things you can do to help figure out what you should do now. So sort of the baseline, eating enough food, then eating lots of plants if you can, then eating a variety of mostly whole foods, ones without packaging or labels, and then, including some additional foods you enjoy, even if maybe they're packaged, right? And then checking in with these other things. Check in with your relationship to food. Check in with your symptoms. Are you feeling any better with your current dietary plan? Check in with your timeline. Have you been restricting more than 10 foods for more than 3 months without any reintroductions? Check in with your own gut, your own intuition. Do you feel like this dietary plan is right for you? And then check in with your provider. Assess all of these things and then bring that feedback to whoever you're working with. And, most providers are going to understand how to take that information. And of course, all of us here will take all of that information into consideration. And then we adjust and we help you adjust with the information and data that you have given us by tuning in and by taking control. So that is the end of the main part of our presentation. If you have questions, please start getting them ready and churning them. I'm going to pass it over to Linda. We're going to do some housekeeping while your questions come in. Oh, Linda, you are muted, my dear.
I see that we're already getting some questions are coming in. And one of the things on our next slide, we really love for you to put in the question and answer. They're topics that would interest you for future webinars. We do a webinar probably about once a quarter. So we'd love for you to put any topics or thoughts that you have in the question and answer. And now Veronica is going to tell you a little bit about our 20-minute consults.
Thanks, Linda. Yeah, so we offer 20-minute consults that are free for prospective patients, people who are curious about what Philadelphia Integrative Medicine does and whether we might be a good fit for your needs and whether your needs are something that we typically work with and are comfortable seeing. So this is one way that we can give back to the community, but also that we can connect and educate on what integrative medicine is and what you can expect in a visit. And so I know that some here tonight have already had, maybe the benefit or the pleasure of having a 20-minute consult. I certainly have had the pleasure of talking with some of you, which has been delightful. But I just wanted to let everybody know that those are available if you have questions or if you want to pursue further, or if you'd like to kind of get a sense of how this might work for you. I encourage you to schedule a free consult. And in addition, moving on, something else that we're offering tonight for participants is a coupon code. So within the next 24 hours, sometime tomorrow, in your email box, you'll get not only the recording of this webinar, but also a discount code that will offer you 10% off of a visit that's scheduled sometime between tomorrow and next Tuesday. Doesn't count for already scheduled visits, but if you schedule a new visit in that time frame, the coupon will be good for that. And it's really meant for all participants here tonight to thank you for coming. So I would encourage you to use that. And now I think we're turning it back to Linda, who's going to tell us about the future.
Thanks, Veronica. Well, speaking of our next webinar, that's going to be March the 23rd, which is going to be a Wednesday. We're going to move from a Tuesday to a Wednesday evening, and it's going to be moving from stuck to spacious, fried to alive. Let's build resilience together. And I will be leading that webinar, and we're going to have a special guest. We're going to have Claire Weidman, who is a physical therapist in the local area, but who has a very special passion for polyvagal theory. And so she's going to come tell us about her study of polyvagal theory and how we can support the vagus nerve, how we can build this resilience. We're going to talk about different tools we can use, about heart rate variability, how to connect into that parasympathetic or rest and digest nervous system, how you can use some of those wearable devices to support you in that way, building better sleep, and also even tips, nutrition tips to maximize our resilience, our self-care, and our sleep. It'll be, I think it's going to be an exciting webinar. I think it'll be the first time we've ever had a special guest in. So we'll really look forward to seeing you. You can register at any time.
Thanks, Linda. I look forward to it, and we love to partner with our fellow healthcare providers in the community. I'd like to invite any healthcare providers. This means psychologists, it means energy workers, it means nurses, doctors, it means any type of healthcare worker or integrative professional to join me for a group that's been happening since 2014. So we have more than 80 monthly meetings. This is a free meeting that is intended for a self-care experience for those who are providing care for others. So please help me spread the word. And we're in the process at the clinic of expanding our offerings. We're expanding our appointment options for you as a patient. We're also expanding our offerings for healthcare providers and healthcare workers and integrated professionals to support this community of people, who we spend our day caring for others. It's learning and practicing how to really care for ourselves and not just talk about it in this group once a month, but actually practice it together. Please join me. Our next group is February 7th. It's Monday morning, which doesn't work for everyone's schedule. But if you register for it, we will send you a recording of the brief meditation and centering for the theme-based group that we have every month. So we have a special theme, and I look forward to seeing you there, or for you to register and receive the benefits of this group. Also, just mentioning that we are an on-site mentoring site for healthcare workers all over the country. We actually have a healthcare worker, a physician, joining us this week for some on-site virtual mentoring to learn how to fully embody the principles of integrative medicine and transition a conventional practice. So we are offering clinician mentoring in that virtual on-site way. People will join us in the clinic and learn all the ins and outs of how to provide the care, how to think about follow-up, how to think about creating a comprehensive plan, how to think about structuring the practice, business modeling, all the aspects to support clinicians who really are committed to a more holistic and embodying the principles and receiving the enjoyment of being an integrated provider, which is a really very different way of practicing than a purely conventional approach, which is a little bit more transactional. So we have free consultations that I'll invite you to. If you're interested, you can sign up on our website to speak with me for 20 or 30 minutes just to see what your needs are. And of course, any of our consultations are intended to see what is your next step for your healing process, whether or not that's with us or whatever that next step is for you. We look forward to partnering with you. And also, please stay tuned for some additional options that we're having available to support healthcare providers and integrated professionals at this time. Thank you. At this time, we'd like to transition, and this is also a great time you might have been receiving and digesting. We'd love for you to continue to ask yourself, what might be something that you would like an answer from us about? What is a personal question? We see that there are some questions that are accumulating in the Q&A, and this is a great chance to give yourself a present and to interact with us, and we see it as a gift to interact with you. We'd love to engage with you and see if you have anything on your mind about what is integrative medicine and this beautiful presentation that Caitlin has pioneered for us and that we've all participated in. We're looking forward to hearing from you and also sharing with you.
So it looks like our first question from JB is, would you partner with my traditional primary doctor, and how does that work? Thanks for the great question. And we love partnering with other healthcare providers. It can be anything, sometimes from a phone call, sending a note, your clinic notes, your lab results are always available on our patient portal. And so you can easily print those off. We can fax them to your primary care physician. We're always very interested to have that network. And we also collaborate with providers as well. So pretty easily done. We have an easy system for that. Thanks, Patty. That is my pup on there. That's Sam, who's been enjoying the cold weather, loving it. Hard to get him in the house. But I'm thinking you've got a question: when tracking macronutrients, how does the chronometer differ from the paid version of My Fitness Pal?
I can take that one. So I really like that Chronometer offers more details on the micronutrients than what MyFitnessPal offers. They're not hugely different. They are similar in a lot of ways, but I find that MyFitnessPal does focus on calorie restriction. So it's automatically providing my clients with lower caloric goals than what I as a professional would recommend. So I don't really like that kind of out of the gate. Almost everyone opens up MyFitnessPal, and I don't agree with that main recommendation. And then you do get some more micronutrient details on Chronometer. Neither one is perfect. Like I said before, they're estimates, but those are the two main reasons why I prefer Chronometer. So.
Thank you. So this is also a great time where we actually have a moment, a space, a gap. So I just want to take a moment to take a breath, to appreciate the incredible people that I work with, my fellow colleagues, the time and energy that it takes to prepare a presentation like this. And I was just looking at some of the slides, Caitlin, and just appreciating some of the images and the images of food and just the level of professionalism. I really am just so grateful for the time and energy that is taken for you to prepare this. And I enjoyed the presentation so much myself. I feel like I have got all my questions, but I might not want to hog all the time and ask those questions. So I also want to ask our colleague team how we'd like to use this time. And
I would like to know if, when we were on the slide about counting how many plants you had today, if anybody counted their plants and wants to share, including the providers. Did anyone take a moment to think about that?
Well, it was kind of fun to think about that. I started with breakfast, and I had some pomegranate seeds, and I had some raisins and some nuts. And then, I got into lunch, and I had roasted a lot of vegetables. Nice. And so putting those with some rice, and I was making bone broth, but I had, 10 vegetables in my bone broth. So it's like, wow, just by doing that, if I don't have to think about the number, but the diversity. And I know that for my microbiome, it would rather have a little bit of a lot of different than, a huge amount of fewer things, So I was just talking with a patient this afternoon. It's like, sprinkle all those things or chop up a lot of different greens to go in your salad. And you can really, it adds up. It was great.
So along the lines of that, Linda, I'll just say that I've recently started to sort of support the microbiome, going to the store and picking 10 to 15 vegetables that I never eat. random radishes and things, dandelion greens that aren't a typical part of my diet, putting them in the food processor together and making a veggie mashup and taking a tablespoon or two of that daily, almost as a supplement, but as a sort of like microbiome support. And I have found that I can tell a difference.
Beautiful. I mean, I could also answer your question, Caitlin. And so this morning, I really like this cottage cheese. It's a full fat, there's sort of 4% milk fat cottage cheese. It's a particular brand that has some probiotic cultures in it. And I like to add either Kalamata olives to it or capers to it because I really, really enjoy salty foods. So that's what I had for breakfast. And for lunchtime, I had prepared a beef stew that I've been experimenting with. Linda has tried this beef stew. So this is not the same version you tried, Linda. This is another version. And I like to put in sweet potatoes and chopped collards and beets into this beef stew. And so my family, we enjoyed some for lunchtime today. So I got some veggies in there. And for dinner, I actually had a family member who cooked for me. And there was a number of proteins, but the vegetables were some orange peppers, there were some tomatoes, there was some chopped onion, and that was all cooked and kind of warmed together. And it was nice to have a chance for a few minutes just to breathe, taste, and sort of walk the talk a little bit and eat and enjoy before coming onto the webinar before we met a little bit early to get started tonight. So I think I did okay with my vegetables today. It's, and I really enjoyed it. Thanks for having me count.
Sometimes it's, you know, I don't think you need to count your vegetables every day or anything, but sometimes it's nice to kind of think back, how many plant foods am I getting? Yeah. And then when you start thinking about spices, you start thinking about beans and grains, and you're like, wow, I am getting a lot of different plants. They're not all produce necessarily, but lots of different plants are coming in, and each color counts, each different variety of apple counts, you know, they all have different nutrients to provide. So it's always fun to kind of start thinking about it like that.
So what we
think those nuts and seeds also are real important, not to forget to count the nuts and seeds. They bring so many nutrients in.
Well, the dried cranberries and the cashews after lunch, I should count those too, right? I want to check in and make a few moments if the providers have additional comments to make. But what I'd like to just summarize for us tonight is that what we've had a chance to see and experience and taste, if you will, Caitlin's expertise and the depth that she offers to our patients every day, and the depth that she brings to our provider interactions when we discuss patients on a daily basis. I think you've also gotten a sense of the collaboration and the ease with which and the enjoyment with which we work together, where we listen and care about and build each other and contribute to each other in terms of our knowledge bases, and also just working together and the enjoyment of working together. I hope that you can also experience that we've created something very special in the clinic, and we'd love you to be part of it. We are expanding at this time. We're so delighted to be able to offer and to continue to offer free consultations, which is really just a time for you to hear yourself and for you to explore what's right for you and for you to see what next step is right for you, whatever that might be, and to see what an integrative approach to yourself, to your health, to your healthcare would offer you as a benefit, because we really feel strongly that this is such an enjoyable thing to be part of. We hope that you'll join us. So unless there's anything else that our providers would like to share, I think we'll get ready to complete our webinar tonight. We hope that you've enjoyed it. We certainly enjoyed spending this time with you. A big thanks to all the people that you do not see, our administrative staff, our management staff, Alexa, who was able very last minute to join us as our facilitator. Thank you so much. You did a beautiful job, Alexa. And I want to thank everyone for participating and for caring for yourself, remembering yourself, and taking in some new information. We hope you have a great night, that you have a chance to rest, to rejuvenate, and also that this has been a bright light and a positive experience and a media experience that's positive, and that we look forward to connecting with you in the future.
Thanks, everyone.